everyone. Welcome to Behind the Mask, the uncensored story of your dentist. Today, we have Dr. Vinod Gunampally with us. Good afternoon, Dr. Vinod. Welcome.
Hi Vaibhav, how are you?
Good, sir. Good. So, Dr.
Fine.
Vinod is one of the leading practitioners in Hyderabad. He has over 2 decades of clinical expertise. First question that I want to ask is how did you become a dentist? While growing up as a kid, were you looking up to someone? Please share that story, sir.
I'll just speak frankly, okay? My journey into dentistry was quite unplanned and in many ways a dramatic, if you could say that. See, I was basically when my turn of getting into profession started, I stay in Telangana, Andhra Pradesh then. I didn't get a seat in my place, but I got a seat in Karnataka. So I was basically eligible for MBBS seat.
Okay.
But unfortunately or fortunately, I can't say that then. There was some kind of miscommunication, and I had to take next available was BDS,
Okay.
and a field I admittedly knew little about it at that time. I hadn't even realized that dentistry existed as a distinct profession. So that twist of fate led me to the pursue dentistry, and it has since become a great passion to me.
Okay.
And I completed my graduation from Bangalore Institute of Dental Sciences, followed by masters from M.R. Ambedkar Dental College.
Okay, great. So, do you remember your first day as a dentist, sir? What do you recall?
Frankly speaking, obviously, it's kind of some expensive material in your hands and some king or emperor sitting on the chair. When some powerful sits on the chair and you are trying to approach, how would your feeling be? Am I doing correct? Is everything going right?
Right.
So as everybody's story, it was the same for me also.
Great. I was going through the internet and I found something interesting that in Japan, there is a teeth festival. Okay.
Okay.
On every 8th of August, they celebrate. So basically, they lit up a lantern and they just symbolically, they just pray for strong teeth and healthy teeth. जहाँ पे locals भी
Yes.
join होते हैं, dental profession भी join होते हैं. So I'm just seeing Japan being so advanced, in technology and everything. So why not
Mhm.
India? India में एक बहुत ज़्यादा ignorance है dental awareness को लेके. ग्रांटेड लेते हैं देर इज इसको सेकेंडरी कंसिडर किया जाता है एंड मेनी टाइम्स पीपल आर नॉट बॉदर्ड अबाउट इट सो व्हाई डू यू थिंक इन इंडिया दिस सिचुएशन इज एंड व्हाट कैन वी डू टू गेट आउट ऑफ इट सर.
The one that leads over there is the government. See, they make sure whatever taxes or whatever that is paid by a general population, it is spent in a wiser way.
Right.
So in that process, whatever healthcare things that the government has to give it to the population, in that dentistry is also being pushed it in a
Yeah.
right manner.
Yeah.
That's when the awareness is
Yes.
increased among the general population.
Yes.
Then when it comes to India, as we are still a developing country even after 30, 40 years, and the population is high, and the government should take an initiative to promote dentistry as well.
Yes.
See, the way they are promoting regular health insurances, PMO Yojana, healthcare, and all those things, they're only concentrating on the general health of a individual, but not particularly about dentistry.
Yes.
So the first step that would start for a good awareness is the government. Then obviously by the dental fraternity.
Got it. Well said, sir. So I was going through some stats. So out of all the cancers that happens in India, 40% cases are of oral cancer. Okay. Approximately 70,000 diagnoses every year, 50,000 deaths every year. So why this, ये इंडिया में इतना ग्रो क्यों कर रहा है? So let's begin. What is oral cancer and how, what can we do to, symptoms and prevention for that, sir? Please throw some light.
See, basically, again, अपना इंडिया में तो the majority of the population belongs to a weaker socio-economic level. Same thing, awareness is one big thing. No, जब awareness होता है, obviously, when some in a small symptom also,
Hmm.
the patient whoever experiences that symptom is छोटा तो awareness होता था,
Yeah.
he would have gone to a doctor and check कर लेता, but that awareness is missing.
Right.
And how many see the country is not only confined to cities, right? Villages hai, districts
Okay.
hai, tier two cities hai.
Hmm.
So every person has their own क्या बोलते हैं ना difficulties of getting a proper healthcare thing.
Right. Right.
So these are the things जहाँ पे oral cancer का जो spread है and the morbidities because of that are more in India.
Okay.
And obviously, oral cancer is the most often caused by tobacco,
Mhm.
smoking or chewing tobacco, alcohol, and HPV infections, and poor oral hygiene. The symptoms like persistent mouth ulcers, red or white patches,
Uh-huh.
unexplained lumps, or difficulty swallowing. These are the basic symptoms.
Right. So I was also reading there is a condition called as pre-cancer. जहाँ पे you spoke about that white patch, जो white patch
Precancerous lesions,
yes.
yeah.
So जो अगर white patch
Precancerous
शायद आ
lesions.
जाता है तो if we can someone can also उस time पे अगर दिखा दे तो शायद these things can be prevented or
Yeah,
earlier.
see, I'll tell you one small example. Say there are conditions in your teeth wherein your teeth get attrited. Attrited matlab no jaldi घिस जाते हैं.
Yeah.
So then what happens is your tooth surface, which is anatomically has rounder borders, and it should not harm other structures in your oral
Yeah.
cavity.
Yeah.
ठीक है. But when this condition happens, जो attrition बोलते हैं, जहाँ पे enamel घिस जाते हैं, because we use daily to daily ना, और हर एक इंडिविजुअल का दे हैव डिफरेंट बाइटिंग पैटर्न चूइंग पैटर्न्स
Right.
और dental conditions depending on that if the teeth get attrited there are some sharp edges that are developed on the tooth
Yes.
and these sharp edges has a regular rupture between the tongue and cheeks.
Yeah.
So आप कहीं पे भी देखिए if you say on your hand with the help of your pen you daily scratch at one place over the period of क्या होता है वहां पे there is
Yes.
one mark kind of a thing. So same thing happens there.
Yeah.
So if you detect that and when you take care of that sharp edges,
Mhm.
the problem is solved.
Right. Right.
So
Right.
this is one of the precancerous lesions.
Okay, okay. So I was reading something that untreated cavity can cause heart diseases and diabetes. So connection क्या है, diabetes में और दांतों के cavities में? Can you please throw some light on that, sir?
Our oral cavity is the main point of entry for all kind of bacteria in your overall health.
Yeah,
Okay. So obviously, what happens is when there is a cavity, there is a bacterial growth. These bacteria needs to feed on something to be alive.
yeah,
When they feed and when they need to excrete things, the only option is through the bloodstream.
yeah.
So blood में mix हो जाता है and it goes obviously your blood has connection to all the vital organs
Right,
in your
right.
body. So that's how that is true. Actually, that statement is true. We call it as pericarditis kind of a condition.
All right. Okay. Okay, let's move on to the next section where we'll talk about some myths and facts. Eating sweet is bad for teeth. Is it a myth or fact?
Not true. Cavities form when bacteria feed on any kind of carbohydrates like bread, rice, and chips, fruits.
Uh-huh.
Not just sweets. Sugar just make it more worse because they
Yeah.
stick longer to the teeth.
Right. Okay. One more thing that dental treatment cannot be done in pregnancy. Is it a fact or is it a myth?
No, no, nothing like that. Dental treatment can be done. See, as we all know, there are three trimesters in a
Yeah.
pregnancy: first trimester, second trimester, and third
Yes.
trimester. There are few ifs and buts. If a patient comes with a dental pain, the first thing as a dentist, what we need to do is we need to take an
X.
X-ray,
Yes. Yes.
and when we take an X-ray, we obviously make it a point to ask the patient if you are expecting, if you are pregnant or not. That is a kind of a protocol that we follow. And though dental X-rays, जो X-rays का power जो use हम करते हैं, which is very minimal, but we don't want to take any chance on that.
Yeah. Okay.
So most of the times we avoid X-rays and we try to give relief to the pain, and this happens most of the times in the second trimester.
Yeah. Got it.
So if required, depending upon that, we can start the procedures and give some antibiotics also, which are safe during pregnancy.
Yes. Okay. Okay. Is oral cancer hereditary, sir?
Genes hai, yeah, we could say it is. There is some kind of codes on every genes.
Uh-huh.
So I could say, yeah, it runs in the family sometimes. We can say that.
Okay. Okay. Let's move on to the next section where we'll talk about some, funny stories about the patients. So, what is the funniest excuse a patient gave you for missing an appointment?
I mean, there are there are quite a few to talk about basically.
Love to hear more, share more than one, sir.
No, एक the doctor I couldn't come because my tooth stopped hurting me. That is the most common on its own. That is one of the commonest things हम जो सुनते हैं ना.
हाँ 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 हाँ.
This is one of the comments. अपने आप आया, अपने आप खुद खुद पे खुद stop हो गया. So I didn't feel the need to come.
Okay.
This is one of the funniest thing.
Okay. Tell us about a tough case that surprised you and how did you figure it out?
As a dentist, we are quite trained in all the treatment plans and diagnosis for years together. And the more experienced you are, obviously, it will be
Yeah.
easy things for you. But the
Okay.
toughest thing in dentistry is जब patient अंदर आता है, he does not trust the doctor basically.
Okay.
The irony is, अरे यार तुमको प्रॉब्लम है
Uh-huh.
इसलिए मेरे पास आए हो, मैं आपको बताऊंगा कि क्या प्रॉब्लम है, उसका क्या ट्रीटमेंट करना है. नाउ टेल मी व्हाई शुड आई कन्विंस हिम टू गेट द ट्रीटमेंट डन.
Yes.
दिस इज द मोस्ट
I know.
टफेस्ट थिंग दैट आई फेस इन माय प्रैक्टिस.
Okay. All right. ऐसा ऐसा कभी हुआ है सर कि यू हैव लुक्ड एट अ स्ट्रेंजर स्माइल और आपने उनको मेंटली थोड़ा डायग्नोस किया है कि इसके थोड़े दांत टेढ़े हैं, ऐसा होता है? क्योंकि
दिस हैपेंस ऑल द टाइम. This happens all the time. Now, even when I speak to you, I'm looking at your smile.
Okay, okay. How
I'm
would you
trying
make?
to find out. I'm trying to find out कुछ मिलेगा क्या बोल के सोच रहा हूँ.
Okay.
As a dentist, yeah, as a dentist, I don't know, but I make it a point to see, observe.
जी.
बाद में सोचता हूँ कुछ बोलूं कि नहीं बोलूं.
हाँ हाँ. नहीं, मेरे मेरे दांत
क्योंकि
देख के क्या लगता है सर आपको?
ये they're good enough. I don't feel anything. I
Thank
don't
you.
feel anything wrong in it. They are
Thank
healthy.
you.
Looks healthy.
Okay, okay.
Got a
Uh,
great smile by the way.
Great. Thanks for the compliment, sir. Next question is, have you tried treating yourself?
So imagine me treating myself. See, it's difficult, but I never tried seriously, sir. I never tried.
Okay. All right, all right. Okay. एक ऐसा स्नैक बताइए सर जो आप पेशेंट को बोलते हैं कि आप मत खाइए लेकिन आपको बहुत पसंद है वो.
Yes, yeah, the universal choice is chocolate.
Okay. Good answer. Good answer.
I do eat chocolates, but I say my patients not to eat chocolates.
Great, great. Okay. All right. So, one celebrity smile जो आपको लगती है it's a perfect smile.
Scarlett Johansson.
Okay.
She
Good.
has a good smile, and apart from that, yeah, Julia Roberts.
Okay. Rapid fire questions for you, sir. Tea or coffee?
Coffee, my other anesthesia basically.
That one gadget that you cannot live without.
My dental loops.
Okay. Your favorite travel destination, sir?
Anywhere which is peaceful, mountains or sea.
If you were not a dentist, which profession you would be in?
Probably I would be a bike racer into the bike racing.
Okay, so you're into adventure sports. Nice.
I would.
Okay. So you like morning clinic hours or evening clinic hours? What do you prefer?
Mornings.
Okay. Great.
नहीं हमको भी क्यों नहीं see everybody has that 9 to 5 job. Why not we as
Yeah.
a dentist?
Yes.
It's
Yes.
up to you. It's up to you whether how you want to develop your practice.
Haha. Okay. Extraction or root canal, which is tougher?
Both are easy basically.
That's a great question. Answer, sir.
No, both are easy, and there's nothing tough in the present scenario, Vaibhav.
Haha.
Instruments, equipment, things are so well developed in dentistry. I
Yeah.
mean, nothing is tough basically.
Okay. Most common dental myth that you hear.
मेरे को अब तक कोई I mean कोई dental problem ही नहीं आया. That is
Okay.
one. That is
Okay.
one kind of common thing that I hear from other people.
Okay.
I have not used even a single medicine and all
Uh-huh.
that.
Okay.
That is not so there. I don't think so. I don't. I can't believe that.
Okay.
Until and unless you go to a dentist, you will get to know if there is a problem or not.
Yes. Okay. So now let's talk about your practice, how you're managing it. I want to ask, how do you strike a balance between providing a high quality treatment and meeting the patient's expectation on the price?
So for me, the priority is always uncompromised quality.
Yeah.
At the same time, I believe in transparency, explaining to patients what goes into into the treatment, why it costs, what it does,
Yeah.
and what long-term value it delivers.
Mhm.
When patients see treatment as an investment in health rather than an expense,
Right.
balance
Right.
naturally follows.
Right. 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 Okay. Do you think practice management software is a must for the clinic? And according to you, what are the ideal feature that every practice management software should have?
Absolutely. Practice management is no longer an optional, basically. It's a backbone for a modern dental office. Beyond
Mm.
scheduling and recording, an ideal practice management software should have patient recall systems,
Uh-huh.
treatment planning, financial tracking,
Mhm.
digital consent forms.
Mhm.
You can upload your all kind of documents, and ideally analysis that gives insights into patient flow, inflow,
Okay.
revenue, and missing opportunities. So
Right. Okay.
they do a major role in a daily to daily practice in a dental practice.
Okay. I just want to understand about what are the challenges that you face in your, daily practice as well. Because see, being a clinic owner, you have a lot of responsibilities. Patient को देखना है, सारे operations, inventory, labs, everything. There has to be. I mean, obviously staff होते हैं, but being a clinic owner, ये सारी चीजें भी होती है, and obviously, practice management software can help you automate a lot of these things. So, how do you manage the patient leakages in the clinic?
Leakage, matlab, can you be
Okay,
little?
so normally when patient comes to the clinic, many times they don't, they don't complete the treatment. Okay, so either
Okay,
they
okay,
cancel
okay.
their appointment, they miss their appointment, or पहली sitting के बाद गायब हो गए. They don't come back.
So basically, see, for me, I have this management software, which I have. I ask my staff to use Bestosys patient tracker tool,
Yeah,
where we can see patients who have not see patients aate hai,
yeah,
they get checked, we
yeah,
give them the treatment plan,
yeah.
and few patients say, okay, मैं सोचता हूँ, मैं तो कुछ.
Right,
Nowadays, window shopping has become very common.
right, right.
We have an option that you can track such patients and we do the follow up.
Got it. Got it. I was checking your website. So, I mean, is your website helping you in growing the practice, sir? Do you get new leads from the your website?
Yeah, we do have our website, but we do not normally track the traffic. So I'm not sure
Okay.
about that.
Okay, okay, okay. So basically, normally क्या होता है कि clinics websites तो बनाते हैं, लेकिन there is no search engine optimization behind that. Okay, because see, when patients search the clinic or any website, if your website is not being no backed by search engine optimization, so your clinic website will not come at the in the top results. So that one thing that everyone should do. And also, we are also adding one feature, which is a chatbot functionality where whenever patient visits your website, there is someone to chat with them on the website. Because see, जब patient clinic में आता है, तो there is a receptionist who can take care about the patients, ask the questions. So similarly, suppose around 10 p.m. in the night, if some patients visits, so there is nobody on your websites to chat. So I mean, we have already have this chatbot functionality. Okay,
That's
what's
a good thing. That
yes,
is really a good thing because addressing to a concern, patient's concern immediately
yeah,
makes the first impression.
yes, yes. What is your secret for running your two clinics very smoothly, sir? What is your secret for that?
सीक्रेट है कुछ भी नहीं है भाई भाई इट्स अ कॉमन थिंग पापी पेट का सवाल है
Good. करना ही पड़ता है. We have to.
they are
Uh,
basically another source of income.
okay, okay, great, great.
I'm just increasing the surface area bus.
All right, so I think that's it, sir, for this podcast. And thank you very much for giving us your time. And
Thank you so much.
I'm
Thank you so
sure
much, Viber.
the viewers will get a lot of insights. Thanks for your time, sir, and have a good day, sir.